What's up, YouTube? It's your boy Wen. This is our first interview, and today we're here with a special guest, and we'll be talking about nursing today, the nursing field, and is it overrated? If you go on YouTube right now, you search up nursing, you're gonna hear a lot of people talking about leaving nursing, about their experience about nursing, and if anybody should go into that field. A lot of people talking about it's overrated. A lot of people are saying that they are underpaid. A lot of people are talking about that they are leaving the field. And I just been doing a little research, and I thought it would be interesting to do an interview with an actual nurse and see this person's perspective on nursing and why people think nursing is overrated. Okay, now nursing actually was something that I was interested in, but it just wasn't for me. Okay, but it's a great field, very much like any other health field. There's a lot of opportunities in it, and it's a very good, lucrative field. Okay, you can make good money, and there'll always be a nursing position out there for nurses. Okay, now I want to get straight to the interview and interview this individual. This individual been a nurse for about 2 years, and she's been really good at it, and she loves it. So let me not speak for her. So let's go ahead with the interview and ask her a few questions. Ask her about the field of nursing and see what's her perspective on that. Hello, Tiana. How you doing?
Hi, how are you? I'm good. Thank you for having me.
No, absolutely. Thank you. Thank you for being here today. And just like many other fields, nursing, in terms of nursing, it's been really one of the fields that's mostly been talked about, and a lot of people are going in it. Matter of fact, it's probably oversaturated. You get what I'm saying? So tell me a little bit about yourself and what made you go into nursing.
Okay, so my name is Tiana. I've been a registered nurse for about a year to 2 years. I was a nurse extern. I got a position at a hospital as a nurse extern, which is pretty much a position where you're in nursing school still, but you're able to precept under the supervision of an RN, and I was able to learn some skills. And then when I graduated nursing school, I got a position as an RN on a cardiac floor. I went to a 2-year associate program. I took 2 years of prereqs, and then I applied to the program. That took about 2 years, graduated, and then I was able to find a job. It was difficult because it was around the time where the pandemic came out, but yeah.
Yeah. So, in general, give me an idea of what made you go into nursing. Specifically, tell me what pushes you. What was the nudge that got you into nursing?
To be quite honest, initially, my first career choice was not nursing. It was more criminal justice law. I was very interested into that field. I did think it was similar to how the TV shows are portrayed, like CSI, Miami, all of that. That's how I thought, I would be working in the field. But when I did further research, I was able to understand that that wasn't going to be the best career choice for me. It seemed kind of boring. So then I gravitated more towards nursing. Nursing is a field that impacts a lot of people daily. I wanted to make an impact in my community, as well as being hands-on directly with patients, being able to help others when they're unable to help themselves. So that was something that really interested me, that pulled me towards that career.
Okay. So I know you previously stated that you've been a nurse for about a year or 2.
Yeah, practicing as a licensed registered nurse.
Okay.
Yeah.
All right. So that's cool. Tell me, while you were in school or before even entering the nursing program, tell me, what did you expect of nursing? What idea you had about nursing? What made you, because everybody have a specific idea of something they're about to get into, like especially when it comes down to their profession, especially like nursing. What did you expect of nursing? What did you think?
Well, this goes for various careers. Obviously, when you're practicing before you get into the field, it's not going to be the same when you're actually out there in the real world, because this is school, this is practice, this is to prep you for what is to come. So in nursing school, we didn't really get a lot of insight into how it was going to be to practice as an actual nurse. It's completely different, versus the textbook, and being on the floor and having to actually be that person that the patient is relying on you to get them healthy, to get them to a better state of optimal health. So it was a lot. It was a lot to transition over from being a student nurse to an RN.
Okay, that's cool. All right. So tell me, when you got into nursing, what did you experience? Was it completely different from what you thought it was, or tell me a little bit about that?
Yes, it was completely different. Obviously, because when I was practicing in school, we would do clinical. Clinical rotations is a hands-on experience for student nurses to be able to interact with patients. Obviously, we're not doing the scope of an actual nurse, but we're able to be supervised by an RN, and they allow us to do certain tests and activities. So it's completely different, because when you're in school, you're taking blood pressures, you're taking temperatures. A lot of facilities didn't allow us to administer medications, to hang IV fluids. So when you're actually on the floor practicing your role as a registered nurse, you're getting calls from family members, you have to communicate with the doctors. It's very overwhelming, because as a new nurse, it's all new to you, having to take all that in at once. I did find myself getting overwhelmed a lot, because on the floor that I am on, it's a critical floor in a way. We get a lot of patients that don't need to be in the ICU, but they need to be more monitored still on a consistent basis. So we have a lot of patients that are on cardiac drips. They come in with cardiac issues. They come in with alcohol intoxication, broken hips, broken knees, it's a lot. It's a lot to deal with and take in.
Right. So tell me about the raw truth regarding bedside nursing. Tell me the worst thing you experienced as a nurse, your first year of nursing, and how was that experience, resonate with you? Tell me a little bit about those experiences, because I've heard so much things about nursing, especially on TikTok, with feces thrown everywhere, with patient cursing you out, with all those stuff. Because I want the viewers to actually know what's going on, especially those who are in nursing school, who have this idea that they're gonna be saving the world, and it's not what they actually think it is. So tell me about that.
Yeah, that's actually quite funny that you say that, because in nursing school, they go, we're going to have a little stethoscope on, we're going to walk in there, hey, I'm the nurse, I have your medications, let me just listen to your heart, let me just listen to this, boom, you're done. No, there's so much more to it. You're that person's server. They ask you to go get food for them a lot. They want you to, comb their hair, things that make them feel better. How else would I say? You're just juggling a bunch of tasks at once. Sometimes the patient wants you to sit in their room for 10 minutes and just talk to them, because they don't have family members that come to see them. They're lonely. They want someone to talk to. So you're there doing all of those.
So you're a psychologist at the same time.
You're a lot.
Okay.
A lot of different careers into one, I would say.
Yeah. Let's get into pay and benefits. Let's talk about that, because a lot of nurses feel like they are underpaid. Not just nurses, but a lot of people that have seen what nurses have done in the hospital. They feel like nurses are underpaid for what they do on a daily basis. What would you say? I want you to tell me, in terms of pay, do you feel like pay is too low for what you guys do, or do you feel like it's just right, or do you think they should pay you a little bit more than what they're offering out there?
Yes, I do agree that the pay it definitely should be higher than what it is, because we have a lot of responsibility, and I feel that if we're paid to the capacity that we're supposed to be paid, I'm not saying that, okay, go into the field just because of money, because if that's what your perspective is, then you shouldn't be a nurse, you shouldn't go into nursing. But you know, a lot of nurses feel that they're underappreciated a lot of times, and I feel that if the salary is at the capacity it's supposed to be, people will be more diligent and excited to go to work and do their job, if you understand what I'm saying. Yeah. Obviously, location plays a role. Depending on where you live, you're going to get paid more because of the cost of living. But I feel that there should be a base salary of at least $80,000, even for an associate degree, you know, coming out of school.
Yeah. So, you know, that's very interesting. You know, a lot of people, you know, especially people from the Caribbean, they tell you, hey, nursing, go into nursing, you know, nursing pays a lot, you know, but somebody looking in and you seeing nursing as like one of the top tier, and it is, don't get me wrong, but in terms of pay for what you guys do, definitely they need to nudge that up. Why do you think people are leaving the nursing? Why do you think that? Why do you think people are leaving nursing within 6 months or a year?
Yeah, so that has been happening quite frequently over the past year. Obviously, when I was a student nurse, I didn't know about all of this. People wanted to leave, how nursing was really like, because I was only a student. I didn't have firsthand how it felt to actually go through it. But now that I'm in it, a lot of new grads and a lot of even veteran nurses are leaving because a lot of people say RN stands for replaceable nurse, meaning like if you drop down or something happens to you, or you quit, and they're gonna find somebody else. To be quite honest, it's a business. They need to run a business. They don't really care much, and that's how we feel. They don't really care much. They just care that the business is still going. I would say that a lot of people are leaving. Like I stated before, they feel underappreciated. They feel disrespected. A lot of patients, to be quite honest, are they're not appreciative of the work that the help that you're providing to them. You'll get cursed out by patients. You experience a lot of racism at times. To be quite honest, racism is everywhere, but it is prominent a lot in healthcare as well. You get screamed and yelled at by doctors, so it's very overwhelming.
Okay, so for the big question, do you think nursing is overrated?
I don't think nursing is overrated necessarily, because a lot of people are still trying to pursue the field, go into it. It's a wonderful field, you know. No matter how overwhelming it can be, I still chose the field for a reason. So I don't really see myself doing anything else, but I do feel that we need more recognition for the work that we're providing.
Understood. Thank you for coming in and doing this great interview. You know, I appreciate you, and good luck with everything. Everybody, you hear it here first. You hear it from an actual nurse, and yeah, what is?
I also have another tip. When you're in school, try to figure out what your niche is. Try to find, you know, when you're going through clinical rotations, try to see what you like. Because I feel if you go into an area or a field that specific area of nursing that you like, you'll be more excited to perform well and do well in that job. Because right now, I got my dream position to be working with babies and to be working with pregnant moms, and that's all I wanted to do when I was in nursing school. I didn't want to do med surg, I didn't want to do psychiatric, none of that interested me. Obviously, that's something that you have to learn and go through in school as a nurse. But a lot of veteran nurses will say, oh, start off on med surg, start off there. That's the only place you should start off when you graduate, because that's where you're going to learn your skills. I do agree that being on a cardiac floor helped me to gain my whole foundation of nursing and skills. But if you can get a position that you're passionate about straight out of school, I suggest that you go straight into it. If that's what you see yourself doing, that's what you should do.
Yes. Thank you for that last part, and I'm sure that is very important. You guys should definitely try to figure out what you like and don't like, and see what your niche really is. You know. Hey guys, I brought the tea on the table. You got it here now. It's up to you what you do with it. Make sure you make a good choice. when it comes down, and understand what you're getting yourself into. Okay, do a lot of research, understand what you're getting yourself into. Do interns, speak to other people and stuff like that are already in the field, and make sure you talk to your professors to really get the tea on nursing. Okay, it is a great career, but you should definitely understand what you're getting yourself to. Thank you for tuning in. Next time, see ya.